My name is Bob Meeks. I live in Brandon, Florida. We had 6 kids. We've got 9 grandchildren, and we've got 5 great-grandchildren. I was always very healthy. And in 2000, I got sick, ended up in the hospital with pneumonia, and I ended up with a serious germ in my lungs, and I came out of the hospital with COPD, which is chronic obstructive pulmonary disorder. And since then, it's been downhill. When I retired, my insurance stopped, and I had to go on Medicare Part D, and that's when all the problems started.
Medicare Part D was a major flaw in the 2003 law that President Bush signed. A donut hole was created. Your first $2,830, you're covered. Once you get past $2,830, you have almost a $4,500 gap where you have to pay 100% of your drug costs. And that 100% you pay while you're still paying your premium.
You still pay your insurance premiums all year, but you have to pay the full price for the medication. If the medication is $271 and you've been paying like a $35 copay, now you pay the $271. And when your medication runs $600 or $800 a month, it really puts a dent in your pension plan.
The cost of prescription drugs has just gone up so much that seniors have just not been able to keep up with it. They're on fixed incomes, and every month they have less to spend on things other than their prescription drugs.
First thing that happened when the IRA went down and was exhausted because of the economy, we had savings. So we've exhausted our savings. The next thing we do, we were buying medicine on credit cards. So we refinanced the house, got the credit cards paid down, and we end up running the credit card back up again on buying medicine. We refinanced the house a second time. So now I've got a high mortgage on a house that we had almost paid for. We just, and we're on the verge of bankruptcy. I have no choice. We've got to do something to bring those healthcare costs down. We've got to have some help.
This healthcare reform bill will help Bob and his wife enormously because, number one, they will have the security of knowing that the donut hole is closing. Seniors will actually have more in their pocket this year as a result of that closing, plus a 50% discount on the drugs that they buy while in the donut hole.
If we can get a 50% savings on the drug costs now, that would be a tremendous help. Anything like that puts more money in our pockets that we can spend, I think it would even help the economy because we'll have more money to spend. Senior citizens have always managed to save some money in their younger years, and then whenever they get older, they travel, they spend money. They can't do it today. But this healthcare reform now makes the future a lot brighter.